Now we are going to discuss about corticosteroids. From pharmacology. Okay, first in the corticosteroids classification, if we see, there are glucocorticoids and mineralocorticoids. Here in the glucocorticoids, now we are going to discuss in this session only glucocorticoids. We have three subtypes. Those are short acting, intermediate acting, and long acting. In the short acting we have hydrocortisone. The intermediate we have prednisolone and methyl prednisolone. The long acting we have betamethasone and dexamethasone. Okay, this is the drug classification, and then we'll see about the mechanism of action. I will make it simple for you. See, there is cortisol or any steroid. This will enter the cell as it is soluble in cell membrane directly, and then it enters the cytoplasm. In the cytoplasm it binds with the glucocorticoid receptor plus glucocorticoid. See, the drug is entering through cell membrane as it is soluble, and then it is forming a complex that is glucocorticoid receptor plus glucocorticoid. Then it enters the nucleus. After that it interfere with the gene transcription. In what region it goes in? It is GREs, that is glucocorticoid response elements. Okay, there it modifies the gene transcription and produces lipocort and increases production of anti-inflammatory proteins. What is happening? First, the glucocorticoid is entering the cell as it is soluble in the cell membrane, and then it is combining with the glucocorticoid receptor and forming glucocorticoid receptor and glucocorticoid complex, and then it is entering the nucleus, and in the gene transcription it is identifying glucocorticoid response elements, and it is promoting the formation of lipocort and increase in anti-inflammatory proteins. Okay, this is the condition. Okay, it's now till now we understood what actually these do. See, apart from this, how inflammation takes place is in the cell membrane. It will be converted into arachidonic acid, and here prostaglandins are formed and leukotrienes are formed, and cytokines, COX, and many things are formed, which will eventually produce inflammation. But this step is taken out by phospholipase A. This phospholipase A takes this step, that is formation of arachidonic acid from cell membrane, and our lipocord will inhibit this phospholipase A. So arachidonic acid is not formed, PG is not formed, prostaglandin is not formed, leukotriene is not formed, cytokine is not formed, thereby no inflammation. And this is the mechanism of action. Hope you understood. And then we'll go with the pharmacological actions. I will make it simple with a diagram. Coming from the top, in the CNS, it has glucocorticoid receptors. With that, it might cause euphoria, insomnia, and psychosis. Okay, in the CNS it might cause those. And think this as bone. In the bone it causes osteoporosis. Why? Because it decreases calcium absorption and it increases calcium excretion. Okay, then it also inhibits osteoblasts, so there is osteoporosis. And then in the blood, think this as blood. In the blood it increases neutrophils and decreases lymphocytes, eosinophils and basophils. How it increases neutrophils? Not by increasing the production, it is by, see, neutrophils are maintained in the circulation, they are not allowed to leave the blood vessel, so the concentration of neutrophils will be increased in the blood vessels. And fat metabolism. In the fat metabolism, there will be altered fat metabolism, so there might be moon phase and truncal obesity, and there also might be buffalo hump. Okay, this is the thing. And coming to think that he has big muscle, and as the time passed it wasted. Muscle wasting. Why is having muscle wasting? Because see, cortisol is released in stress condition, so the blood should contain more and more glucose. So what happened, this muscle breakdown happen, amino acids are formed and from this glucose formed. Okay, due to this glucose hyperglycemia may occur. What we are seeing, first thing, to increase the glucose, the muscles are being broken down and amino acids are produced and glucose is formed, and with this one different, right? Glucose is produced and there is hyperglycemia. Okay, if it is in prolonged, we can see muscle wasting. How many we got? We'll count. 1, 2 blood, 3 CNS, 4 fat metabolism, 5 muscle wasting. Okay, these are the most important things. And one more, which we should never forget is the immune system. See, there is immune system, right? Immune system, initially the macrophages are down regulated. That means this activity is reduced. As macrophages are APCs, antigen presenting cells, it might also decrease the activity of T cell activity. Decrease, this one decreased, and then due to T cell activity decrease, there is cytokines decreased. So due to overall decrease, see, first one, macrophages are decreased, means activity is decreased, so that no antigen presenting cells, so T cell activity decreased. No T cells means no cytokines, decreased immunity. And one more, if these cytokines are not there, no inflammation. So there is no decreased immunity, decreased inflammation, blood neutrophils are increased, bone osteoporosis, CNS euphoria, insomnia, psychosis, and in muscle there will be muscle wasting. And these are the pharmacological actions. Now we'll discuss about therapeutic uses and adverse drug reactions. See, in the therapeutic uses, for remembering sake, draw this diagram, not in the exam, for your practice. You can give it in cerebral edema. From top you are coming. Then you can give in autoimmune diseases like systemic lupus erythematosus and rheumatoid arthritis, where if immune system is decreased, the efficiency of immune system is decreased, so that the inflammatory reactions will be decreased. That will be happening in this. And you can take adrenal Addison's disease, where the adrenal gland cannot produce enough cortisol, and then we can take in nephrotic syndrome. What happens in nephrotic syndrome is there will be immune complex deposition in the glomeruli. So what happen, there will be inflammatory reactions happening due to this immune complexes formation, so the glomeruli will be damaging. So in nephrotic syndrome also you can give. And in organ transplantation, and you can also give in inflammatory bowel disease, that is ulcerative colitis and Crohn's disease. In ulcerative colitis and Crohn's disease you can give, that both are under inflammatory bowel disease. And these are the most important therapeutic uses. Organ transplantation and this Addison's disease and autoimmune disease you should surely write. And in the adverse drug reactions, again draw the same diagram. From top, in the CNS it might cause mood changes, and it might also cause insomnia. And then it might cause osteoporosis. Why? Decreased calcium absorption, increased calcium excretion, and decreased osteoblast activity. Okay. And then in the eye, the ocular tissue might damage over time and cause cataract. And cushingoid like symptoms. What are those? Buffalo hump, moon face, and truncal obesity. Okay, there might be this, and there is muscle wasting also. Muscle wasting due to increased glucose production, these muscles will be broken. No, there will be muscle wasting, and it might also precipitate hyperglycemia. It might also lead to diabetes mellitus. And see, to the wound to heal, to the wound to heal, there might be inflammatory reactions which produce then after collagen. But here the inflammatory response is decreased, right? So there will be decreased collagen which is required for wound healing, and there will be delayed wound healing. Okay, and from this brain only, there might the adrenal gland might go into atrophy. Why? Because as this ACTH is suppressed, adrenocorticotropic hormone is suppressed by external steroids, so that if you stop abruptly taking steroids, our adrenal gland might not produce cortisol properly, and you might land up in cortisol crisis, so adrenal crisis. So you should not abruptly stop. And here in adverse effect, adrenal atrophy might also occur. And one more thing, that is opportunistic infections. Opportunistic, because as immune system is decreased, the fungi which is present in our oral mucosa and in the genital regions, they will take up and can cause, like example, like candidiasis they might cause, oral candidiasis and genital candidiasis, and this one opportunistic infections might happen. What all we discussed: mood changes, insomnia, cushion-like symptoms, buffalo hump, bone face, truncal obesity, osteoporosis, and immune system suppression, ACTH, ocular management, and this delayed wound healing, and it may also lead to glaucoma also it might lead to. These are the most of the important therapeutic uses and adverse drug reactions. Now we'll discuss about contra indications and drug interactions. The drug interactions, right, directly rifampicin, phenytoin, phenobarbital, non-steroidal anti-inflammatory drugs, anti-diabetic drugs, and also potassium wasting diuretics, not sparing, it is potassium wasting diuretics. Okay, potassium wasting diuretics, if you give along with them, it might lead to hypokalemia, because the steroids also excrete more potassium, hypokalemia. And in anti-diabetic drugs, the effect of anti-diabetic drugs, see, it is the steroids are doing hyperglycemia, and we are giving anti-diabetic drugs. What is the use of combining both this, right? So there might be failure of this anti-diabetic drugs. Okay, in NSAIDs, there might be increased risk of peptic ulcers. There might be increased risk, and all these three induce cytochromal enzymes and lead to failure of steroids. The steroid will fail, not this rifampicin, phenytoin or phenobarbital. The steroid, these drugs will induce the metabolism of the steroids and the effect of steroids will be decreased. And in the contraindications, you can write the person already suffering with fungal infections, because I already told it might lead to candidiasis or any other fungal diseases. And peptic ulcers you should not give. Why? Because I told that if this is a gastric mucosa, the mucus production will be altered, right? So it should be contraindicated in peptic ulcer. It should not be given in hypertensive patients. Why? Because or dose should be, if he should be surely given, dose should be maintained. Hypertension, because it causes salt and water retention, so it might cause hypertension. And it should also be used in glaucoma. It should not be used in glaucoma. And live attenuated vaccines. See, why? Because our immune system is already suppressed. So if you give this live or live attenuated, they might divide and cause the disease. So you should not give. And in contraindications, what you can take else? Okay, mostly these are the things: fungal infections, peptic ulcers, hypertension, glaucoma, live attenuated vaccines should not give. And some more things are also there, like in the pharmacological actions I told, osteoporosis, right? So you can write in osteoporosis also. Osteoporosis. And you should also not give in diabetes mellitus, because there will be increased production of glucose. So these are the contraindications and drug interactions, and we finish the corticosteroid class. Thank you.